According to the CDC, more than 1/3 of adults in America are obese, and obesity brings with it other health problems, including diabetes, heart disease, and some types of cancer. There's a new clinical trial regulated by the FDA at Holyoke Medical Center testing the Ellipse balloon, a non-surgical method to help people struggling to lose weight. Carolee McGrath sat down with Dr. Yanis Raftopoulos, the director of Holyoke Medical Center's weight management program, to learn more.
This is a trial that 10 hospitals nationwide are involved, and we are one of them. We're the only hospital in the Northeast. And I'm very excited about this trial because this device I had the experience and the opportunity to work with in Europe. I was part of the European trial. And now we have the opportunity to do the same thing in the US, and hopefully the device will pass the trial and eventually will be commercially available in the US, hopefully in the next 2 or 3 years. There's nothing really else in the weight loss field that you can actually produce substantial weight loss without some kind of intervention, sedation, anesthesia, endoscopy, or surgery. This is the only thing really available to my knowledge that potentially can do that. So it's pretty exciting.
So no surgery?
No surgery, no anesthesia, no endoscopy, absolutely nothing. So this is the actual capsule. The capsule is originally attached to this catheter because you need that catheter to eventually inflate the capsule to become a full balloon, and you need the catheter to instill the fluid into the capsule. So the patient has to swallow the capsule originally with part of this catheter. The other end of the catheter obviously stays out of the mouth, so we can use it to connect the fluid and fill the capsule. It's not, as you can see, it's a sizable capsule, but it can be swallowed. In my experience with some practice and training, most patients can do it. We also have a practice capsule where the patients can actually practice with at the office before the actual placement, and that helps a lot. Mm-hmm. So the process takes place at the radiology department because we need to confirm by X-ray where the capsule is, and it's in the stomach before we actually inflate it. So the patient simply ingests the capsule with water. It goes into the stomach. It takes about 3 or 4 minutes to do that. Once we confirm by X-ray that it's in the stomach, then we connect the other end to the fluid. We fill the capsule with about 500 cc's of fluid, and then it becomes this balloon.
And that stays in their stomach?
Correct. Once it's fully filled, we do another X-ray to confirm that everything is fine, and then with a simple pull, we detach the catheter from the actual balloon. Then the balloon stays in the stomach for about 4 months, and eventually there has a safety valve which is closed, and in about 4 months' time, it opens up automatically. It's programmed to do that, and then deflates and passes in the stool.
So that's it. No surgery. And so that keeps them satisfied? It helps with the appetite?
Correct. The idea is that, when we eat the food, occupies a space in the stomach, and that produces satiety, and then you stop eating. Obviously, when we eat the food is processed by the stomach, digested, then passes into the intestines, so then you get again the sense of emptiness, and you eat again. The whole idea of this is that, it's permanently in the stomach for 4 months, so it produces a constant sense of satiety, and it reduces significantly the appetite and the urge to eat.
So what happens after 4 months, though? Is this process something that can be repeated, or is that where the whole lifestyle change is really worked in?
Correct. Very good question. It can be repeated. That's one of the unique things about it. And in Europe, I have had experience of patients doing it twice. I think, though, the idea of this device, but even with more aggressive methods like surgery, in my opinion, if the patient and the doctor doesn't devote enough time to really change their lifestyle, the activity level, the behavior during the day, what they do every day, how food plays into their daily life, and if you don't change all these things, I think eventually anything you do could potentially fail, and that's what we see a lot. So my philosophy with the device is to help them throughout these 4 months to change what they do. And hopefully when the device is out, they do things in a different way. And that can help them stay healthy and maintain their weight loss. Of course, some people that start from a very high weight, they may not be able to achieve all the weight loss they need with one device. And in theory,
4 months,
in 4 months, correct. And in theory, it could be repeated a few months later again. But the whole idea, again, the ultimate goal is to change them, really make them do things differently in the long run. Otherwise, everything we do, it's temporary, and then weight gain can happen.
So you had success in Europe. Obviously, it's being sold commercially now. You have 33 patients who have done this so far in this area. How have they done? And especially, my question is about swallowing that capsule. Is there anxiety with the string going down their throat as well? How have they done with that?
Yeah, it's not, I'm not going to say it's the easiest things you do every day. But I was fortunate because having the experience that I performed the trial in Europe and have done it commercially in Greece for the last 3 years, I have understood better how to tell the patients how to do it. So I had asked the company after the first trial to develop a practice capsule, first of all. It would be exactly the same size of the real capsule, so patients can actually see it before the actual day of placement and teach them how to actually do it. That makes a big difference. So I spend a lot of time educating, preparing the patients in advance, and they are psychologically more ready when they come to do it. The 33 patients we've done so far have done very well. We haven't had any issue with any of them. I have to mention that this is a randomized trial, so not everyone gets the real balloon. About 2/3 of the patients recruited will get the real balloon, and about 1/3 will take the sham, which is exactly the same, but it's not going to become a balloon. And then at 6 months' time, we will disclose to them what they have, and the people that had the sham, they will be offered the opportunity to have the real balloon at the second 6 months of the trial. So everybody will have the opportunity to do the real balloon, but some of them will do it at the second part of the trial. One thing I want to mention, which goes along with the difficulty swallowing this, is there is an alternative way to do it. The company provides a metallic stylet that you can pass through, through this catheter, and that allows the catheter to be more stiff. And then I can gently pass it through the oropharynx instead of patients actually swallowing it. In the past, I had to use a stylet about 1/3 of the time. But with experience, I haven't had to use it not even once during the trial. So far I'm very excited because, it can be done with a stylet as well, but I feel it's a little bit more difficult experience for the patient. And avoiding it, I think it makes it even a nicer experience for them.
So that your patients must be happy. And at what point does surgery become the only option, for patients that you're dealing with?
The balloon is actually, during the trial, it's actually designed for patients with a BMI between 30 and 40. Just to remind for the audience, a BMI of 30 is the beginning of obesity, and a BMI of 40 is the beginning of morbid obesity. So BMI of 30 means you're about 35 pounds overweight from your normal weight, and a BMI of 40 means about 100 pounds. So basically, you have to have a weight that is over the normal, between 30 and 100 pounds. So after that amount, over 100 pounds, then this balloon is not indicated, and it won't be indicated in the US if it becomes successful through the FDA trial. So surgery becomes the alternative option for patients with a BMI over 40. There is an alternative indication for surgery when your BMI is between 35 and 40, so basically midway between the two ranges I mentioned before. But you have to have one other medical condition with it. And the ones that usually we look for is diabetes, heart disease, sleep apnea, high cholesterol, and hypertension. That's the main ones we look for. So the patients must have one of those and a BMI between 35 and 40. If the body mass index is over 40, then they could be completely healthy without any medical condition, and they could qualify for surgery.
Well, thank you so much for coming in and talking about the Ellipse balloon, and I will certainly be following up with you, and the best of luck to those patients as well.